Hi, my name is Leslie Chambers. I'm the president and CEO of the American Parkinson's Disease Association. And I would like to welcome all of you to our Facebook Live question and answer program, where we will focus on challenges and issues for the Parkinson community as it relates to COVID-19. The American Parkinson's Disease Association is the largest grassroots organization providing programs and services for the Parkinson's community, as well as supporting research to find treatments and ultimately the cure for Parkinson's disease one day. If you're not familiar with the American Parkinson's Disease Association, or APDA, I would encourage you to visit our website at apdaparkinson.org, where you will find a wealth of information at our national website, including publications, information, about national resources, as well as information and programs and services in your local community. You may also want to call our 1-800 number if you have questions during this challenging time, where our professional staff can lead you to either resources, again, nationally or locally. And that number is 800-223-2732, and that's also available on our website. For today's program, we will be hearing from our expert resident on Parkinson's disease at the American Parkinson's Disease Association, Dr. Rebecca Gilbert. She is our Chief Scientific Officer, and she is also a practicing clinician at Bellevue Hospital, where she is a movement disorder specialist treating patients with Parkinson's disease. In today's program, Dr. Gilbert will be providing general information about the pandemic and how it impacts your life if you have Parkinson's disease. Following her brief presentation, we will open up the chat lines for your questions. So we will encourage you to type in your questions and following the prompts so we can get to as many of those as possible during the program. If you haven't connected with APDA on Facebook, I would encourage you to do that today, as well as on Instagram and Twitter, where we will continue to share stories, resources, and most importantly, invitations to future online events such as this. I would also like to announce that we will be planning and holding our next webinar on April 29th. I would encourage you to participate in that webinar, where Dr. Daniel Weintraub, who is a professor of psychiatry and neurology from the University of Pennsylvania School of Medicine, will be providing a presentation on brain health, and will be discussing a variety of issues, including mental health issues and challenges as it relates to Parkinson's disease. When you visit our website, we will be mentioning throughout the program some of the resources that are available to you. And one of them that's most important is this booklet called Be Active and Beyond. And during this time when folks are cooped up in the house, it will be extremely important that you continue your exercise and wellness program. So I would encourage you, if you don't have that booklet, to download that on our national website. And now it gives me great pleasure to hand the program off to Dr. Rebecca Gilbert. Dr. Gilbert.
Thank you so much, Leslie. We are now in unprecedented times, as everyone keeps saying, because we are interacting with a novel virus, which has come to the world, as far as we can tell, over the last few months. Originating in China and now has spread across the world. Now, this virus, as everyone keeps saying, is a relatively benign virus. And so for the vast majority of people who get infected with this virus, they have mild symptoms or no symptoms at all. So why is it causing such an extreme reaction around the world? And that is because for a small percentage of people, the virus can result in very significant complications, respiratory distress, respiratory failure, and death. And so the world has been grappling with a virus that is spreading extremely rapidly. It's an extremely contagious virus. It's spreading to people who are getting minimal symptoms. They feel well, they go out in the community, do whatever they need to do, spread it around, lots of people get it, and a small percentage of those people are getting extremely ill. And we see in certain countries that is resulting in very high numbers of deaths, not something that the world can tolerate. And that is what America is dealing with now. And so as we see over the past few days, past few weeks, various governments, including governments of the states, various states of the United States, are creating rules that are trying to keep this virus under check. And what you hear is what we're trying to do is flatten the curve. If we do nothing, then the virus will spread in its predicted way, and there will be a surge of patients who need critical resources from the hospital all at once. And so what the rules are trying to establish is for the spread to be slower so that the drain on our hospitals and resources will be lower at any given time and more spread out to allow for more ability to treat anyone who needs to be treated. And so what's happening are rules that are keeping people away from crowded venues, creating rules that don't allow crowded venues to occur, etc. And I want to be clear that there are really two types of people that are involved in this process. One is the general population. The general population does have still a low risk of getting serious complications from this virus. And those people are asked to obey these rules or commanded to obey these rules as a public health command to keep the spread of the disease under check. There's a second group of people, and those are the people who are at risk of serious complications, who are being asked to stay away from large venues for their own safety because they're at risk of getting severe complications and needing to utilize the resources, and we don't want that to happen. And so the question that everyone with Parkinson's has in their minds are, am I in that second category? Am I a person who is at increased risk and at increased risk of getting the complications of this virus? Now, again, let me be clear. We do not think that Parkinson's disease itself is a risk factor for contracting the virus. We think everybody has a really high risk of contracting the virus. It's a very contagious virus for everyone. What Parkinson's disease may do is raise the risk of complications once the virus is contracted. And as we all know, Parkinson's disease is an extremely variable condition. And so there are people with very mild symptoms. They may have a tremor and that's all, and there may be people with extremely advanced symptoms. And so there can't be one rule for everyone, as there never is in Parkinson's disease. We can safely assume that patients who are moderate or severe Parkinson's or advanced Parkinson's disease are most definitely at increased risk from this virus for a whole host of reasons. Primarily because people with Parkinson's may have difficulty coughing and getting out any secretions that build up. They may have trouble taking in a deep breath because of rigidity of the trunk. They may be frail overall, malnourished overall, low weight, and all these things are going to increase a person's susceptibility to getting these complications. The question is, what about the mild people? And this we just don't know. And so we have been advising anyone with Parkinson's disease to consider themselves at high risk from this virus. Having said that, we would like to pivot this conversation less of a conversation about the virus itself and more about what we can do to help the Parkinson's community that finds itself in this state of relative isolation. And so we'd like, over the course of this Facebook Live conversation, to discuss ways to stay connected, to stay exercising, and to stay engaged. All extremely important things that one with Parkinson's disease has to continue doing for health, for wellness, and to keep the Parkinsons really at bay. And so that is really our focus today.
Great. Thank you, Dr. Gilbert. I see that we have our first question from the audience today. It's coming from John B., and he would like to know, does PD qualify as a so-called underlying medical condition?
Right, so that is the ultimate question. And as I was discussing before, for moderate and advanced Parkinson's, I would say the answer is 100% yes. Parkinson's disease should be considered an underlying medical condition because Parkinson's disease predisposes a person to have difficulty with their cough, have difficulty with their swallow, and therefore leads a person to have more difficulty clearing secretions that another person may be able to clear more easily. And in addition, people with Parkinson's disease may not be able to take as full a breath as other people, which again leads them to having difficulty maintaining good respiratory intake and getting all the bad stuff out. And that again would predispose to potential complications from this virus, leading to more difficulty with respiration when compromised. The question, and I'm not sure, John B., where you fall on the spectrum of Parkinson's disease, if you have very mild Parkinson's disease, is your respiratory system affected at all by your Parkinson's disease? Again, we don't know. And so we are advising, without more information, we are advising to consider Parkinson's disease in general an underlying medical condition. So let me be clear, when the information is gathered about underlying medical conditions, the conditions on that list are heart disease, respiratory illnesses like asthma, diabetes, cancer. And this data has been collected, and it's extremely clear the death rate of a person without these conditions is X, death rate of people with these conditions is Y. We know that information. Parkinson's disease is not on that list. We do not know the answer to your question. And so without that information yet, we can only speculate with some education behind it, but it really is speculation. And for now, knowing the etiology of Parkinson's, knowing how Parkinson's works in other respiratory illnesses, we can assume that yes, respiratory function would be affected in Parkinson's disease and may predispose to complications from this virus. That's what we can say now.
Okay, great, thank you. Thank you, Dr. Gilbert. We have a second question, and this comes from Roger H., and he would like to know, if you have just received approval for the pump, would you go ahead and have the surgery or postpone?
Right, so I've received a version of this question in some different forms. I'm assuming you are referring to the Duopa pump, which is an infusion, a levodopa infusion directly into the small intestine. This is a surgery that's performed typically on people who have a lot of difficulty taking the oral medications, because the oral medications give high surges of the medicine, resulting in potentially uncontrollable movements like dyskinesias, and then the person has a low level of their medication and they're cycling throughout the day. And so this treatment allows for even distribution of the dopamine throughout the day. Having said that, this treatment is elective in some way because you do have the oral medications to fall back on, and those are the medications presumably you're taking now. So if you are a person who is on deck to get a Duopa pump, that implies that you are not a mild Parkinson's disease patient. You either have moderate or advanced disease, just based on your reactions to the medications. So I would recommend to postpone this surgery and not to necessarily jump into this brand new treatment right at this point for a number of reasons. One, you're in the hospital, you're going to be exposed to people with the virus potentially unnecessarily. You're going to be more frail after this procedure than before, potentially short term, of course, as you recover, but it does put you a little bit more at risk. And then you're going to need tweaking of the dose, and that's going to require more interactions with more medical people. It just seems better part of valor to to push off this type of procedure.
Great. Thank you, Dr. Gilbert. We have our next question from Joanne F., who would like to know, is there anything different a Parkinson's patient should do?
So the first thing, of course, is to follow the instructions of your local government, who's telling, and consider yourself a person with an underlying medical condition. So follow the rules for people with underlying medical conditions. And so for most things, I would say, no, you're not different than another person with an underlying medical condition. However, as a Parkinson's patient, you know that your need for movement is different than someone else's. A person with Parkinson's disease knows that if you're sitting for too long, if you're doing anything for too long, you have more of a chance of getting stiff, and your day is just more complicated if you're not moving. And so the challenge is that we need to listen to our Department of Health. We need to, if in your area, such lockdowns or whatever they're being called are in place, then you need to stay at home as much as possible. How do we dovetail that with continuing to move? And that, I think, is a major challenge for people with Parkinson's disease specifically. And so this is something that I've been addressing, and there'll be an article on our website about this tomorrow, but just as a preview, the first thing to know is that going outside is not forbidden if you are able to stay away from other people. And so it is definitely encouraged to take walks with your immediate family, to jog, to bike, whatever is something that is safe for you to do if you're able to stay away from other people. That's strongly encouraged to get outside. And so definitely keep moving. And then when you're inside, trying to keep exercising within the confines of your home is going to be something extraordinarily important. And APDA has a number of resources for you to tap into at this time. The first is the book that Leslie held up the cover of, the Be Active and Beyond book. And let's see if Leslie can hold that up again. Okay.
Can you see that? Okay.
And that is something that can be downloaded from our website. You would go to apdaparkinson.org and you would go to educational resources, and it's under publications, and you can download that and follow the exercises on your own. If you want to engage directly with an instructor, we have a large archive of exercise classes, and I'll tell you how to access that. They were filmed in our Greater St. Louis chapter, an APDA Greater St. Louis chapter, and they are all archived on a YouTube channel. So what you would need to do is go to youtube.com and search for APDA Greater St. Louis, and their channel will come up, and you can play a whole host of Parkinson's disease specific exercises, including Tai Chi, there's yoga, there's kickboxing, there's chair exercises, there's all sorts of different modalities, and that really can be your home base of exercising at home. There's such a plethora of material. You can do a different video every single day until this is over. And so I really encourage everybody to do that. So that's youtube.com, and then search for APDA Greater St. Louis, and you can access all that wonderful information. And so there are ways to stay active at home, and that's something we really want to drive home today.
Great. Thank you, Dr. Gilbert. We have another question, and actually I'll provide a little information on this and ask you to as well. This comes from Jennifer K., who would like to know, is APDA doing anything to help support groups meet online and reduce isolation? And Jennifer, this is something that we're very concerned about as an organization. How do we reach out into all the communities to help with this isolation? And so we are looking at some creative ways of getting small groups or larger groups together online. Some are already doing this, and there are some resources available for this. One of the things we're also implementing is through our information referral centers and chapters, our program staff are actually calling folks individually and making sure that folks who are already in existing support groups are checking in on one another. We've had some volunteers from some of the support groups who are willing to pick up groceries and do those things, of course, following local public health guidelines. So we will be looking at what are the best practices across the communities and then instituting some of those, we hope, nationally. And Rebecca, I think you probably have some ideas on some of this as well with support groups in isolation.
Right, absolutely. I mean, this is really key, and people who are used to going out and interacting with people are all finding this isolation so difficult. There are thankfully many online platforms that can be utilized to move things online, and we are joining the bandwagon to get that to happen as well. So please stay tuned about that.
Okay, and I think, I'm not sure if we mentioned smart patients, but that's one thing that's available too, and that's on our national website.
Right, that's a great point. We have sort of an online forum that's already up and running that you can access on our website, and that would be a great substitute until the online support groups get activated.
Great. Thank you, Dr. Gilbert. I just wanted to make a note. Evidently, we're having some broadcast issues with Facebook. In some cases, the video is freezing. So we're working with them. And I wanted to remind all of you that this actually will be taped and will be available on Facebook following the live program. In addition to the questions that we receive on programs such as this, I know Dr. Gilbert receives a lot of questions through her blog or directly reaching out to her. And over the past several days, we've received a number of questions around some major themes. One is, should I try to stay away from my grandchildren because of the virus?
Right, so this is a question that I've received in many different forums. Children are tricky because you don't necessarily listen to instructions not to touch your face, to wash your hands for 20 seconds, all the things that you've been hearing about, which are difficult for adults to do and are difficult for children to do as well. So they may think that they're being hygienic, but there's probably less of appropriate hygiene among small children. So that's one thing to be aware of. And then the other thing is children do seem to be much less at risk of getting ill from this virus. Thankfully, that's wonderful for all of us parents out there. But it does mean that they are, as far as we can tell, equally able to get infected by the virus. And so we have a large number of children running around perfectly healthy, spreading the virus. And so that is very difficult for the adults who want to be around these children. It's the primary reason why a lot of schools, I think at this point most schools are closed, because children will get infected but be fine and therefore can spread it around to each other and go home and then give it to their loved ones who are older. So it is probably best to keep children away from people who are older and have underlying medical conditions. It's certainly an issue in my family. I have 3 small children and an older mom, and definitely trying to keep everybody apart for the moment.
And as our audience probably knows, one of the things we're recommending is using your WhatsApp or some of your different apps on your phone. It's not as great as being in person, but you can certainly generate those smiles from your little grandchildren. So I would encourage folks to continue at least using digital devices to visit online with your family.
Absolutely.
Here's one that not only affects people with Parkinson's, but all of us. How do we keep from going stir crazy in the house?
Right, so that is a wonderful question, and every single person in this world, it seems at this point, is grappling with it on some level. What I would strongly encourage is to create a schedule. This works great for kids, especially where you have certain things that you know you're going to do on a given day. So you're going to get up, you're going to do your 30 minutes of exercise, you're going to then walk around your garden, and you're going to do some gardening, then you're going to come inside, then you're going to make lunch, then you're going to Zoom with your grandkids, then you're going to do another exercise. If you have it planned out and it seems really exciting and busy, that is really helpful. If you just have a long day, you have wake up and you have 12 hours before you have to go back to sleep, or you have the television on for the whole time. It really makes things long and drawn out and just really horrendous. So I would focus on, or I have been focusing on, finding ways to do things that you've never gotten a chance to do before. Start exercising more than you ever did. Start gardening. Start learning a language. There are all these opportunities that you've been pushing off that you can access either in your garden, in your home, or online that are available to you. And so the silver lining to this horrendous situation is that you may have a chance to do something new and you may enjoy it. And so let's think about the positives and the silver linings, and that's hopefully will help us get through this.
Great advice for all of us, Dr. Gilbert. Thank you. Here's one, and I know you've received a number of questions about surgery. Many hospitals are limiting surgeries to urgent cases only. I have deep brain stimulation and may require a battery replacement soon. I'm nervous that I won't be able to get the surgery if needed. What should I do?
Right, so this is certainly a big worry for many people with deep brain stimulation in place. Now, unlike the ADPA pump that was not yet in place in the last question, somebody who does have a deep brain stimulation system in place and is thinking that their battery life may be toward the end, this is not necessarily a postponable procedure. And so what I would do now is call up your neurosurgeon, call up your neurologist, and have a conversation with them now about what the possibilities are, and what the plan would be if the battery does die. Would that be considered a surgery that you would come in and get the battery replacement or not? If yes, then you're good. You can rely on the fact that you will be given the surgery if needed. If not, then you will need to discuss with your neurologist what medications you would need to take if the DBS system does fail, because similar to the ADPA system, people typically get deep brain stimulation when their medications are erratic and they're having trouble with ups and downs of the medications, but it doesn't mean that they can't take the medications. It means the medications are just not as good as the deep brain stimulation. So in a situation where the deep brain stimulation may fail because of a battery problem, reverting to medications would be necessary. And so discussing with the neurologist what the plan would be in terms of what medications to take should that happen, have those medications available, and that should lessen the worry and the anxiety about the battery issues.
Great. Thank you, Dr. Gilbert. We have another question from Diane H., who wants to know, I am recovering from surgery, which was done on January 24th for a broken foot, Jones fracture, and I'm scheduled for a follow-up appointment with my podiatrist on Thursday. My last appointment was a little over a week ago, and the fracture continued to show some improvement. Would it be worth the risk to keep the appointment, or should I continue to stay home? I know my age, I am 68, makes me more vulnerable to the coronavirus.
All right, it's a great question. It's sort of an urgent appointment. Is it urgent enough? It's a foot fracture. They typically recover without you going in to see an orthopedic surgeon. It will probably recover anyway. What I would do is call up your orthopedic surgeon. That person will be able to give you the best advice. There is, or your podiatrist, whoever the surgery is with, whoever the appointment is with, to discuss whether it really truly is necessary for you to come in. Like what would be done at the visit that can't be done over the phone, potentially a follow-up x-ray, but if the x-ray, what would be the result of that x-ray that is necessary for you to know that result right now? And you may find that the podiatrist is in agreement with you, that it is not necessary for you to come in, but you know, I don't know what they would say. So I would be cautious as you are being, and really go in only if it's absolutely necessary.
Great advice, thank you. We have another question, Dr. Gilbert. David C. asks, is there any evidence that the antiviral Amantadine could be preventative with regards to COVID-19? I see that it was studied regarding SARS.
Right, I also read a little bit about this. We definitely do not have enough information. As you all know, or many of you know, Amantadine was originally designed as an anti-flu medication, and that it was on the market for influenza, and which is a virus, but is not COVID-19, as you know. And when it was taken by people with Parkinson's who had the flu, they discovered that their Parkinson's symptoms were better. So it was very sort of fortuitous that this connection between taking Amantadine and having Parkinson's came to be. And then it was studied separately as a medicine for Parkinson's, and now by and large is not used for the flu, is used for Parkinson's disease and also used for dyskinesias in Parkinson's disease. So whether it's going to show efficacy against the COVID-19 enough to be actually useful, I don't know. I don't think that's known yet, but it's certainly exciting that that possibility, as well as many, many others, many drug companies are rushing to the scene to try to develop medications. A number of medications are already in clinical trial. There's a vaccine already in clinical trial. So one thing that all these predictions about what may happen, and there's so many different predictions about what may happen, what they don't seem to take into account is human ingenuity. And I have a lot of faith in humans that we are going to come up with something that may stem the tide in some way. Obviously, that isn't a sure thing, but certainly something that we have to keep in mind, that we have to consider all the different potential treatments that may help this virus eventually. So if Amantadine is helpful, then fantastic, but we just don't know that yet.
Okay, well, I agree with you, Dr. Gilbert, on the optimism. We all could use a little more optimism, so thank you for that. Due to the disruption that we had a little while ago, we thought we'd like to repeat the question about the support group. So I'll just have you repeat the information on that. So Jennifer Kay wanted to know, does APDA do anything to help support groups meet online and reduce isolation?
Right, so we are working to get support groups online and different support groups around the country. Some are already online. It depends on which support group is you're referring to. So yes, this is something that's actively happening, and so that is a big priority of ours. And until then, there are a couple of ways to gain support. One being calling our 1-800 number, which is 1-800-223-2732. And that is a great way to reach a person to discuss any mental health or issues that may be on people's minds, and to help people get funneled to appropriate resources in your community.
Great. Thank you, Dr. Gilbert. Another one that I know we've received through your blog, this is from a 70-year-old woman who was diagnosed with Parkinson's 4 years ago. I'm scheduled for an upcoming colonoscopy. My father had colon cancer, and I have an increased risk for colon cancer too. Do you think it is safe for me to interact with the medical staff at this time, or should I postpone the procedure?
Right, so this is a difficult question to answer. It depends what the rules are in your community. Your gastroenterologist may be canceling this procedure regardless, or maybe going ahead with it. It very much depends on what your risk of colon cancer is. I mean, nobody wants the results of this lockdown for there to be unintended consequences, medical consequences for people who are not getting care or pushing off care during this time. So it's really quite a delicate balance. Typically, colonoscopies can be pushed off a few months without any problems. But if you have a high risk of colon cancer, you have a high family risk of colon cancer, you may have had polyps before, you may have bleeding in your stool, there's 100 different variables. But you and your gastroenterologist will need to discuss together the risk of needing to find the colon cancer early versus exposure to the virus. Typically, I would say the procedure will likely get canceled or postponed, I should say, but that very much depends on your specific situation, and so that's something to work out individually.
Great, thank you, Dr. Gilbert. And our final question, this comes from one of our readers of your blog. My father has Parkinson's disease, and I usually take him to his PD exercise class once a week. the class is canceled, so how can I get him to keep moving?
Right, so that's a really tricky question and something that we grapple with all the time in people with Parkinson's, whether they're in isolation at home or not. There's sometimes a big difficulty with motivation of people with Parkinson's disease. They may have what we call apathy, which is a disinterest in activities and needing to be nudged a little more than other people. So this problem is going to play out even more so under these difficult situations. And my best advice would be keep trying to encourage, keep pushing, keep coming up with exciting and innovative ways for your dad to move that encourages him and keeps him wanting to participate. And don't give up, because we all know how very important movement is, especially under these very, very difficult conditions.
And Dr. Gilbert, actually, I see we have a few more questions that came in. Ann C. has a question. Is it safe for a Parkinson patient to fly?
Right. So right now, the CDC and the guidelines that the president has released would say that all non-essential travel for people with underlying medical conditions should be absolutely reconsidered. What's the definition of essential travel? I'm not sure, but certainly travel is particularly at-risk time, and that's because you're sitting very close to people for a long period of time. That's really the issue. It would be the same issue in a movie theater where you're watching a long movie next to people. That's sort of what a plane is like. So there isn't really any concern that the plane itself is going to increase your risk. There's recycled air all the time, and there's a lot of a movement of the air and cleaning of the air. There are these very, very high intense filters that filter out the air in the cabin. So that's not the issue as much as you're just in close quarters with the same people for a long time. And so that does increase your risk of getting the virus. And so definitely non-essential travel of all types should be postponed at this point.
Great, thank you, Dr. Gilbert. And here's one for healthcare personnel and workers. I'm a nurse in a hospital. My husband is 71 and has Parkinson's disease. Is it okay for me to be around him and care for him?
This is a tricky question because the nurse has responsibilities and probably feels a very large responsibility not to renege on what she's supposed to be doing. However, without a doubt, hospitals now are a big source of the virus in terms of areas which people should stay away from if they don't absolutely need to be there. And healthcare workers are at high risk. I mean, there's been articles up the wazoo about healthcare workers and exposure and how difficult it is for the families of these healthcare workers. So if these families of healthcare workers are medically compromised, that becomes very difficult. And so if the family member is responsible for taking care of the medically compromised person, then there's a big problem. And so one thing to do would be to talk to the administrator of the hospital and try to figure out what to do. This person is probably not the only one who is in a situation where they have to care for a medically compromised person and are at intense exposure to this virus. Now, what I should mention and what I should have mentioned earlier at the very beginning is that age is very clearly associated with complications from this virus. And you look at the graph, the death rate in young people is really low, and as you rise in age, it skyrockets to above 80. The death rate is 14%. 70s is really high too, less than 14%, but very high. And so age alone is a risk factor, which means many people with Parkinson's will have the risk factor only because they are of the age that are at higher risk. And so if a nurse has a husband who's 71, that person herself may be at higher risk of contracting the virus from age. And so, I'm sorry, not contracting virus, developing complications from virus. And so this is something that healthcare workers across the country are grappling with, and there are no easy answers, but it is certainly something to bring up with her supervisor.
Great, thank you, Dr. Gilbert. And we would, at this point, get ready to wrap up our presentation. I would encourage anybody who has a question, or you think of a question after the program is over, to send it to Dr. Gilbert. You can check that out at our Ask the Doctor feature, which is on our website. And to remind everyone, once again, to take advantage of all the resources that are available at apdaparkinson.org. I would also encourage everyone to look at our social media channels, where we will continue to post presentations and programs such as this. This program, which is live streamed now, will be uploaded onto Facebook, as well as our other channels that I mentioned as well. Once again, I'd like to remind everyone about our upcoming webinar on April 29th, which you can sign up for if you go to our website, and to call our 1-800 number if you have any more questions following this program. And I see we have a late-breaking question, Dr. Gilbert, if you could take one more.
Of course.
And this question comes from Jennifer R. And Jennifer asks, how can a caretaker of a person with Parkinson's get a break while quarantined with them?
Wow, this is an exceptional question, and one that I'm getting in all sorts of variations. So what seems to be happening in many places is that home aides are not coming to work for good reason, because the home aide has a family which may have an exposure, and they don't want to bring that exposure to the person, the frail person with Parkinson's. And so people who are accustomed to having aides help with care no longer have that, and the burden is falling, or the need to care for the person with Parkinson's is falling to the care partner, which was not the case before. And this person who is the care partner of someone with Parkinson's may have had sole responsibility of the person with Parkinson's for 12 hours, and the aide had the other 12 hours, and now the care partner has the 24 hours. And it's becoming very, very difficult. And there's a limited ability to get help because everybody is isolated with their family and maybe have exposures, and it's a very, very difficult situation for many people. And so how to get a break while quarantined is a great question. And so again, what I would recommend, and it's something that I see works in my family, is again making that schedule, trying to come up with we're gonna watch TV from 10 to 11, and then we're gonna take a walk around the garden, and then we're going to have lunch, and schedule the day so that it's not so overwhelming, this 24-hour period where all this has to happen, and try to break it up like that, so that for the hour of television, you can maybe step aside for a bit and take a moment for yourself, and then come back and do the next activity, and it isn't as all-encompassing. Again, very, very, very challenging for everyone, and especially for the care partners who are thrust into this very unprecedented situation. And on that note, I definitely want to have a shout out to our care partners, who are always our unsung heroes every day of the families of people with Parkinson's, and in today's environment, all the more so. So care partners, we know that things are extremely challenging, and we salute you.
Great, thank you. And we know that in many cases it would be great if we could have care partner groups or support groups for the care partners too when things get back to normal. I do have another question actually that came in from Beth. And Beth asks, this is a timing question, Dr. Gilbert. So she recently brought her father back on a flight. He's 88. Brought him back home so he could have better care than where he was located, and to make sure he didn't get the virus there. He's now been in quarantine for 11 days with no other symptoms. So how long do I have to worry about him being at risk?
That's a great question. 11 days is a really long time. That's fantastic that he did not have symptoms. I have heard 10 days, and I've heard up to 14 days. So the standard seems to be 14 days, but you are close. And so I would be hopeful that he will get to the 14 days without symptoms. You're almost there.
Great, great. Really helpful information. So that wraps up our program for today. If you do have questions, again, I would encourage you to go to our national website to the Ask the Doctor feature, where you can submit that question to Dr. Gilbert and she'll return to you. So thank you very much, Dr. Gilbert, for all the information, and we hope to provide more programs like this in the near future. So thank you, everybody, and have a great day, and please stay safe. Thank you.
Bye, everybody.